The other variation of frequency modulation is the swing modes, where frequency modulation is combined with modulated intensity, change in gap, and change in damping parameters. There can be up to 4 swing modes in your scanner device. First mode, swing 1, is the universal swing. Swing 2 is the intensive swing. Swing 3 is the careful swing. So what does the swing mean? These modes were developed to avoid the body getting used to the influence and maximize its responsive reactions. If a patient has a slow progressing process, we could use a swing mode to intensify the responsive reactions of the body. Swing mode 4, chaos, is a separate thing. In this mode, frequency, intensity, and gap are changed chaotically and randomly, and damping is changed cyclically. In this mode, we can obtain the strongest responsive reaction when treating chronic patients with prolonged and clinically unchanged symptoms. Chaos mode is also good in fighting the pain pattern that presents in the central nervous system in case of long-existing pain.